hope everyone is enjoying the evening so far. I have the distinguished pleasure of being here this evening with our chair of our board, Todd. Thank you so much for being here this evening.
Thank you.
And to my left, I have Dr. Tollie Elliott. Thank you so much for joining us here tonight.
Thank you.
Dr. Elliott, when we were doing our budget in March of 2019, we never, envisioned that we would be in this situation, that our lives would be totally shattered by the middle of March of 2020.
Not in a million years now.
We were there trying to figure out how we would keep all of our 700 employees safe, healthy, while also trying to come to work and take care of the most sick patients and the most worried patients with COVID. Tell us a little bit about the transition that you made from seeing patients in the clinic every day to being in a tech.
And I think that the entire message was from everybody, from the medical team, the behavioral health team, the dental services team, the programs team, to basically engender trust from the community, because there were a lot of mixed messages early on. And so we had nightly meetings, sometimes 2 hours a night, well after the sun had set, to make sure that we set the tone and make sure that the staff and the patients and participants understood what was the latest news and what was to be expected. Certainly come mid-March, March 18th, that's when we started having patients being seen out in the tent to make sure we could segregate the patients who may potentially be at risk for COVID-19 away from the patients that were most vulnerable, most at risk, pregnant women, young children, elderly, those that are sick. One of the big things that came out of that, though, was actually embracing what we had already been doing, which was telemedicine. The telemedicine service had started. We had done maybe 3,000 visits in 2 years. But then when you pivot and go to 80% of encounters in such a short period of time, in that month of April alone, we saw close to 10,000 encounters out of the 14,000 visits, which is quite significant. But at the same time, we had to embrace safety. And so I think by pushing that message, by keeping people up to speed as to what was going on, what were the latest recommendations, trying to struggle to make sure we had the PPEs, and then making sure that you can make the patients come in a timely fashion and get them the trust, I think that made a tremendous difference in terms of trying to have some sort of success during your global pandemic.
What about what was happening with the staff and the struggles that we're going through in this country at the same time?
I think that we dealt with one sort of trauma, health trauma, with COVID-19. And then you had a lot of social concerns and issues, and the death of George Floyd and others. Fortunately at Mary Center, we had established what is called an IDEA committee, Inclusion, Diversity, Equity, and Awareness. And that was focused on evidence of communities at large who have been kept off to the side, so to speak, who have not been considered as human as everybody else is. And because of that IDEA committee, and because its presence, we had a racial equity committee, we had a disabilities committee, we had an LGBTQ committee, we had a senior wellness committee, and these committees were kind of stood up in place with the staff that was there to support it.
So we were dealing with healthcare, we were dealing with social justice, and we were dealing with trying to make sure that our staff remain intact throughout this whole period. Thank you so much for your leadership.
Thank you.
Todd, I just want to first of all say thank you as the chair of the board and the entire board of Mary Center. You have provided the support that we needed to continue to get up every day and do it all over again. Thank you so much for that support. From the moment that we got into COVID and you heard about Mary Center, that call that you got, that we had to transform to the future. Tell us a little bit how you see that.
Well, I think for me, and I think for most of our board members, our minds went to the importance of Mary Center in this moment. Disproportionately, the population impacted by the pandemic are the very population that Mary Center is focused on. So we wanted to make sure that Mary Center in this moment, but also going forward, is well positioned, well resourced, well supported to meet the challenge that's necessary to make sure the high level of quality care that Mary Center is known for continues, and in particular is increased to meet the demand that this pandemic has created. My mind also went into how we could be more supportive of the center and the staff, recognizing that the staff, Mary Center was sort of a microcosm of what everyone else in the country was going through. Everyone was trying to provide whatever care they were providing. Mary Center certainly providing high-level health care, but also maybe working from home, confronting their own health issues, confronting the need to take care of other family members who either needed an education or perhaps health care themselves. We wanted to be there to be supportive of Mary Center's staff as well as the institution to make sure that in this moment and also going forward, Mary Center was there to confront and deal with the new normal.
Thank you so much, Todd. I want to appeal to each of you watching tonight to think with your minds and feel with your heart and reach as deep as you can to help Mary Center attend to those in desperate need. Stay healthy, enjoy the closeness of your family, and please vote and help others to do the same. Thank you for this evening.